That's it. اوكي تمام. طيب كده تمام. اوكي تمام. طيب اهلين، انا اسمي ريناد. طيب دقيقة. اوكي لا اوكي. اهلا، انا اسمي ريناد بهبري، حاليا اشتغل في جونز هوبكنز هوسبيتال as a respiratory care practitioner. فلو يعني ما عندكم مانع حشرح كل شيء بالانجليزي، لانه تقريبا التخصص كل شيء فيه له حيكون بالانجليزي. اوكي. اول شيء what is respiratory therapy؟ مرة احد فيكم سمع عن respiratory therapy؟ ولا هل تعرفوا ايش معنى كلمة respiratory؟ صح. فكلمة respiratory has to deal with the lungs, breathing, and everything that has to deal with it. So respiratory therapy is pretty much a healthcare field that specializes in the lungs. It specializes with any problems that have to deal with breathing, or any therapies or machines that have to deal with the lungs. So anything that has to deal with the lungs, that would be under our profession. So respiratory therapists go to school to become specialists that focus with everything that has to deal with the lungs. That's it. Good? All right. So people who go to school for respiratory therapy are called respiratory therapists or respiratory care practitioners. So once you get your degree, once you pass your board exam and get your license, that's what you get called when you go to a hospital. So I kind of summarized everything about what respiratory therapy or what respiratory therapists are. So first, a respiratory therapist is a certified medical professional that focuses on the lungs. They treat patients who have difficulty breathing, patients who need any interventions with breathing machines or breathing medications. So RTs, that's what we kind of get called in the hospital. Everyone just summarizes our name, respiratory therapy, RT. So RTs are not doctors. They're considered specialists. So the difference between a specialist that's not a doctor and a doctor is that the doctor goes to school and studies the whole body. They're able, well, they have an MD degree, but they're able to prescribe medications or therapies. They're able to order anything that the patient needs. A respiratory therapist is a specialist. So what we do is we're pretty much following what the doctor's order. However, it's pretty much a teamwork. We work together. So if I notice something with a patient is wrong and it needs like a specific medication or a device, I would go to the doctor. I'm like, hey, I noticed this and this and that. What do you think about using this medication or this device for this patient? So overall, it's a teamwork and we're all working together. So I'm not only giving medications or putting patients on devices, I'm pretty much assessing. So when I go in, I'm about to give an inhaler. So I don't just give the inhaler. I go in, I take a listen to the patient lungs. Do they sound clear? Does it sound like they have secretions in there? Pretty much, I would look at their oxygen level. Do they need oxygen? Is their oxygen 100% on room air, or do they need like more equipment to give them oxygen? So I have a few examples of them right here. The simple one would be a nasal cannula. Have you guys ever seen this one? Yeah. So this one would get hooked up to oxygen, and it gives oxygen to the patient that requires more oxygen than what we're inhaling now. So right now, room air is 21% of oxygen. That's what we're all breathing right now. Sometimes patients will need more, and that's when they end up on a nasal cannula. If they need more than that, then we would go on different devices, which I will go over later. But that's pretty much just a summary. So who do we treat? Or what kind of patients do we treat? So we, as you can see, there's like a baby, and then there's an elderly person. So everything from a newborn all the way to a person that's 100 years old or more, we treat everything. However, it depends on what you specialize with after going to school. So when you go to school, you're going to learn about treating all ages, babies, adults, everything. However, once you graduate and once you take your board exam and start working and practicing, that's when you like try to pick like a hospital or a place where you get to treat the patients that you want to kind of work with. So for me, I work with adults. So I'm pretty much experienced with treating adults and everything. However, I learned about babies and I learned about kids. But because I gained more experience with adults, if I ever work in a kids unit, the treatment methods are going to be different because they're smaller human beings that need different kind of treatments, and we can't use the same like settings or same machines on kids or neonates. So what do respiratory therapists do? So I'm going to go over the list, but I'll kind of describe things without making you guys bored. So first thing is assessing the patients with lung diseases. And I went over that at first. So when I go in the room, I listen to their lungs, I look at their oxygen requirements and everything. This is pretty much assessing. So while I'm assessing, I'm normally in there to give them a breathing treatment. Have you guys seen someone use an inhaler before? So that's a breathing treatment, or that's an inhaler. A breathing treatment would be kind of similar to what an inhaler gives you, but it would be for a different device. So an inhaler gives you the treatment right away. Yeah, you would just do that and then take a big deep breath and hold your breath in so that the medication goes all the way to your lungs. However, for patients who require more treatment or are more sicker, they tend to use this one. Have you guys seen it before? So this is a nebulizer. So it's pretty much, for example, this patient is taking an albuterol inhaler. I can still give albuterol with this. So it's just the empty vial, but it would be a solution. I would open this. So I would open this, put it in there, close it, connect it to oxygen or air, and then the flow will go in. It'll make this solution into very small particles, and then it'll flow out. So it's going to look like mist. So when that happens, patients can put their mouth around this and they just breathe. So the medication will go all the way in. So that's part of the assessment and treating patients with lung conditions. Then the next one on there is airway clearance devices. So we work with airway clearance devices, and what they are is pretty much whenever you get sick, don't you feel like whenever you cough, you have like a bunch of stuff that comes up with your cough? So that means with the infection that you have like secretions in your lungs. And when you're coughing it up, you're bringing it all the way out. And that helps you to breathe. However, sometimes patients are very sick and they can't cough up. So what we would do, we would use airway clearance devices. So this is your airway, and it's pretty much a device that helps you clear it. So take the stuff out. So the devices are pretty interesting. So some of them are kind of like a green tube. You would blow into it and it has a fan inside. So the fan would make vibration and it will move stuff into your lung. Another one is a vest. So you would wear a vest. It's kind of like a life vest. It straps up really tightly and then you hook it up to a machine and the machine makes everything shake. So that one is also helping shake up secretions to help the patients cough up whatever they have in their lungs. So that's part of airway clearance. Then you have medical gas administration. So have you guys like studied in chemistry different kind of gases? So there's oxygen, there is helium, nitrogen, and all kinds of gases. So for respiratory therapy, we don't just give oxygen, we give helium mixed with oxygen, and we give inhaled nitric oxide. So there's many different inhaled gases that are used as medicines. So for example, Heliox, patients who have asthma. Do you know what asthma is? Gotcha. I'll go over that later. But for asthma patients, whenever they breathe, there's like an infection in their lung, like not an infection, but pretty much the muscles of the lung starts to spasm. So this is a regular muscle in the lung. Their muscles shrink. So it becomes very tight to breathe. And that's when sometimes you see in cartoons, like they would breathe faster and then they would use like a paper bag and stuff. It's because their lungs feel tighter and tighter and they feel like they can't breathe enough. So for these patients, some of them who are very sick, you give them oxygen, you give them breathing medications, it doesn't work. So Heliox, it's helium and oxygen mixed together. It's very light. So it helps go all the way to the lungs and all the way to the body to help them breathe better. So that's one of the medical gases that we give. And then inhaled nitric oxide is another gas that's given normally in operations or after like heart surgeries and stuff like that. So this one helps the vessels that's in the body. It helps opens it up more. So then the body is able to take more oxygen and carry it through the body. So that's just an overview of medical gases. And then we have inhaled medications, which is what I just went over recently. So it's breathing treatments that would just be missed. We give so many different kinds. It can be a medication like albuterol that helps open up the lung, or something like sodium chloride, which is a medication to help patients cough up whatever is in their lungs. Then you have drawing and analyzing blood gas. So we don't also just give breathing treatments and stuff like that. We are able to draw blood. However, it's a specific kind of blood. So whenever you go to the hospital and they have to draw blood from you, where do they draw it from? Yep, so it would be like for an IV right here or right here. For us, we would actually use the artery, like the artery that's right there. And why do we use that? It's because it has the fresh blood. So even the color of the blood is different. So when they get the blood from here, it would be more dark red. However, if they get the blood from right here, which is the artery, it would look kind of like just like the chair. It would be very bright red. And that kind of blood will have the level of oxygen, and it would give you like how sick the patient is or what kind of device the patient needs. So that's the kind of blood that we're able to draw, and it's only that one. So we can't really get IV stuff like the nurses do. It's just going to be an ABP. And then we have non-invasive ventilation machines. So non-invasive ventilation machines, it's pretty much a machine that will help you breathe. But the word non-invasive is important because there is also mechanical ventilation. So they're kind of the same thing. The only difference is that non-invasive is something that is not going in the body. So it's going to be like a mask that is attached to a machine that pushes air strongly. So it's supposed to help you breathe. So if someone is very weak to breathe, that mask is going to be tight sealed and it's going to push air in, and it's going to make it easier for the patient to breathe. Then you have bronchoscopy. So bronchoscopy is something that I honestly have never heard of until I went to school. And it's pretty much, I think I have a picture of it later, but it's pretty much a scope, a long scope that has a camera at the bottom. And they would, sometimes it's done in the OR, sometimes it's done in like the ICU in the hospital. And it's pretty much this camera with the tubing scope goes all the way through the mouth, into the airway, into the lung. And that's when they see what the lungs look like. Sometimes they may even like suction secretions to clear the lungs out. So it's used for so many different reasons, but it's an interesting device. Then you have intubation. So intubation is a tube that goes either through the nose or the mouth, all the way into the lungs. It's used for patients who are very weak and can't breathe for themselves, and they end up on a breathing machine. So, and mechanical ventilators are the machines that would breathe for the patient. And then the last one is tracheostomy care and management. So it's a different kind of tube. So if someone had the tube that goes through the mouth or the nose for a long time, and they were not able to get off the breathing machine, they would end up getting a different tube that stays for a longer time, and it would be around here. So it's a shorter tube, it goes into the lung, and we take care of it and we assess it every time that these patients are in the hospital. So that's pretty much kind of an overview of what we do. I included pictures because words do not make sense if it's something that's very new to you guys. So these oxygen tanks, you see the big ones, we call them H tanks, and it's almost as tall as me. It's huge and it needs a cart to carry. So heliox, nitrogen, and all the other gases, it would be in tanks like that. If the patient needs oxygen for home, it's definitely going to be a smaller tank that they can take home with them. And then the picture up there, that is a picture of a baby that has a breathing tube. So it's a baby that is very small that cannot breathe for himself. So he has a breathing tube that is connected to a breathing machine. The breathing machine is doing the breathing for him while he grows so that he can be old enough to breathe for himself. Then you have another one. This is non-invasive ventilation. So it's not into his lungs, that picture right there. So it's not in his lungs, it's a mask that's into his nose and it's helping him breathe. And then the one in the corner, that's the nebulizer that gives the breathing treatment that I showed you guys. And then that machine right there is a mechanical ventilator. So it's pretty much, if a patient is very sick, that is the lungs for the patient. That machine is doing all the breathing and the patient would be pretty much not doing much. And then, sure. Good question. I completely overlooked that. So whenever a patient has a breathing tube, they will have a different tube that goes into their stomach. Just because the breathing tube is, for example, if it's through their mouth, they're not going to be able to chew or anything. And most likely they're going to be under medications where they're not awake enough to feel the tube because it's going to be very uncomfortable. So they would have a tube that goes through the nose or the mouth that gives them food. The nurses would actually mix medication and give it through that tube too. So you know those like very not tasty medications that you have to drink? They can give that through that tube and the patient wouldn't have to like feel it. But yeah, that was a very good question. So whenever we take the breathing tube out, we take out that tube where they get the food from because they don't need it anymore. Once the tube is out, they can eat for themselves. But yeah. So where do respiratory therapists work? Pretty much anywhere that you have to deal with the lungs, a respiratory therapist can work with. So here's a few pictures of an ICU. That one is kind of covered up, but it's an adult ICU and it's a picture during COVID. So that's when they would have like the whole, I mean, COVID is still happening. So that's when we have like the full gown. You would use N95s or PAPRs. And for us, it's very important because we're always treating patients and we're very close by their face. So you would give medications and everything where like it's easy to be exposed to anything. So that's why you have to protect yourself first. And then that one is a neonate ICU. So it's for newborn babies. So it's an intensive care unit. And then that one is a baby just getting a nebulizer. So, or a kid getting a nebulizer. So it's more in stable floors where it's not like an ICU. It's intensive care and like patients who are very sick. And then you have that picture in the corner. So that one is mostly done in clinics. So that would be a respiratory therapist that has patients that come by appointments. So it's not like in an ICU where you're working like 12 hours continuously in the hospital. And then, oh, another thing about it. So this one is mostly a lab where they test the ability of your lungs. So you would exercise and they see if your like oxygen level drops. They would see how strong your heart is or how fast your heart rate is. So a lot of cool stuff happens in that lab. And then we can also get on helicopters or the EMS cart because if they have a breathing tube, they need someone that knows how to manage that machine over there. So they need us there too. So yeah, at Johns Hopkins, we would always get calls like if I'm in the ICU, they're like, yeah, they're flying a patient from a hospital to our hospital. So they would sometimes transport patients if they need a specific like treatment or something that our hospital has, and that's when they would have to transport patients. That's pretty much a summary of the pictures that I just explained. But just to add more, you don't have to work in a hospital, you can work in education. So you can teach other people how to be a respiratory therapist, or you can work in a business company that sells respiratory equipment. So it's something you went to school for. You would just teach other respiratory therapists, like, hey, this is a new machine that we're selling. It does this and this and that. So you would have more ideas of what you're selling because it's what you went to school for. And then home care and nursing home. So this is pretty much for elderly people who don't, who live in a facility where there would be nurses. If it's someone that needs any help with breathing, a respiratory therapist would be helping them. And respiratory therapists can actually go to patients' homes to provide care. So as you can see, like we can be anywhere from like a hospital to a home to a school. And then I included this picture just to show you kind of what the lungs look like, and then I'll discuss the other pictures in a little bit. So this one kind of shows different lung diseases. The first one is pneumonia, and it's pretty much an infection. So during like the infection period, the lungs gets filled up with a lot of like fluids. And that's when patients cough, it sounds very like congested. So that is pneumonia, and like inside the lungs, all the way to the end, there's like small, I don't know how to describe them, small balloons that are called alveoli. So that's the smallest part of your lung, all the way to the end. It's kind of like a tree, but upside down. So over there, like it would get filled up with stuff, and that's when like patients have to cough up more stuff. And then bronchitis, which is also another infection. And then asthma. And that's when I explained to you guys about asthma and how like the lungs would feel more closed up. Then you have emphysema, and that's the opposite of asthma, when the lung is stretched out more. So you would inhale air, and then you can't really exhale everything. You feel like your lungs are still filled. And then on the opposite side, you see where like the mouth is, and then how the arrows are heading down. So that's the airway. That's where the air passes through. The opposite one is where food passes through. So what happens when someone chokes? Yes, correct. So that's when the food goes to the wrong area. And in that picture over there, you can see how the food went to where you breathe. And that's when you keep coughing and coughing and coughing. So when you keep coughing and coughing, it's your body trying to kick that piece of food that went to your airway out. So this is something that I find very funny. When someone chokes at home, what do you guys do? Yes, but what does your family do when you're choking?
Just there.
Good. What do they do? Yeah, so I've seen it a lot at home. They would like tap. So if this is something that's stuck here and I tap, what's gonna happen? It's gonna fall down. So when you're coughing and trying to bring the food upwards, they're doing this and the food is falling down. It's making it hard to kick it out. Yeah, so I learned that through school, and it confused me a lot. I was like, oh my God. So instead of helping, we're making it harder for them to cough out. So that's just one tip. So when someone chokes, you can encourage them to cough better, but don't do that. Yeah, just a fun fact. So these are some of the stuff that I already went over, but you guys get pictures because as visual learners, like this will be so much easier. It will make so much sense. So I mentioned bronchoscopy where I said there is a scope that has a camera at the end. It's that picture in the corner. So it goes all the way into the lungs. It has a camera at the end, and it's kind of like playing video games. Every time I saw it, I would be like surprised. Why? Because you're going in, but it's the opposite of what you control it. So if you go this way, the camera goes that way. You go that way, the camera goes the opposite way. So I say it's a video game just because they can use this if someone accidentally inhaled something and it went to their lungs. So, for example, this is a true example. Like for women who wear hijab, sometimes they would put pins. And there were cases where they would accidentally put the pin there and then it accidentally goes into their lung. Scary, right? Yep. So they can use this device and it would have a clamp at the end. So kind of like the ones you would see in the arcade where it catches something. So they would use that, they go all the way to their lung and they would take it out. So we tried that in school. They gave us a dummy or a doll and we tried to practice. And it is the hardest thing ever because when you take stuff out, if it hits the lung again, then it falls. So yeah, but then again, this is done mostly by a doctor. The respiratory therapist would be helping with it. So that's when you give the doctor the medication. That's when you do every other thing than controlling the scope itself. And then, let's see. So that picture over there just shows the breathing machine. And then this one has a nitric oxide. So it's a different gas. It bleeds into the breathing machine and it goes all the way to the patient. And then over there is intubation. So remember when I said a tube goes in from the nose or the mouth all the way to the lungs? This shows it over there. They would use a blade. So it's that metal piece all the way at the top, a laryngoscope. It goes in and they pull upwards to see the airway because it's easy to put a tube into the, like where you swallow food, into your stomach. It's easier to do that than to put it in your lungs. So it takes a lot of skill to actually use that tool, see where the vocal cords are. So that's what causes you to make sounds and talk, and the tube would pass through there. So once the tube passes through there, you can't talk because the tube is in the way between your vocal cords. And then that's another breathing tube, but it's for patients who had the other breathing tube for a longer time, and endotracheal tube. So this one is a tracheostomy tube. If a patient had their tube for like 14 days, that's when they get the tracheostomy tube. And they can get that one off if they're doing well. They would put smaller sizes and then they close it. Yeah. And then this machine right here. Have you guys ever seen someone when they go to sleep, they would put a mask on and they would go to sleep? Yeah. So that mask is CPAP. Okay. They're telling me to hurry up. So that mask is CPAP. It's pretty much some patients, when they go to sleep, they stop breathing at some point. And that machine is air that goes in with pressure. So it helps whenever they stop breathing, it's giving them more air and it's pretty much helping with oxygenation and keeping them alive and breathing. So yeah, it can be used for stable patients who are going to sleep. And in cases where a patient is very sick, sometimes we would use this machine too. So the Saudi Commission for Health Specialists, I kind of skipped this step, but this is pretty much kind of what you would like here in the US. To be able to work in a hospital, you would have to go to take your board exam and then your license. In Saudi, this is what you have to go through. Any field that is in healthcare, you would have to go through them. And it's pretty much the commission that regulates anything that has to deal with healthcare. So your board exam would be done through here. Your license would be done through here too. Advantages and disadvantages. I wanted to go through this because respiratory therapy is not for everybody. I knew someone who went to school and then at the end, once they started working, they're like, I did not realize it's a lot of walking. It's a lot of walking, it's a lot of being on your feet. And sometimes you're gonna be very stressed. So for example, in an ICU, in critical situations, they're gonna have like 5 nurses in the room, but for respiratory, it's gonna be you. And if you're lucky, someone else is gonna come check on you. So it's pretty much kind of, you have an important role, but you have to be able to think and stay calm during situations like that. So advantages, good pay. And then you can work in so many different areas, home, school, hospital, everywhere, pretty much. And then you're always learning something new. So although I went to school, I learned about stuff, but there's always new researches happen. There's always new devices. So it's always a learning place. Then flexible schedule. So I work 3 days a week. Sounds fun, right? So the rest of the week I'm off. However, it's 12 hours. So half of the day I would be working. I used to think it's a lot of time. However, when you're working, you would be so busy. So 12 hours goes by fast sometimes, but you do get tired at the end of the day. And as you guys see, I just came from work. So I worked from 6:30 p.m. to 7 a.m. So I'm still alive. I'm still moving. So it can be tough. However, it's doable. And once you get used to it, it's not that bad. Different hospitals, sometimes they would have like 8 hours. So you don't really have to do 12 hours. It depends on where you work. And especially if you work in a school or like home care or stuff like that, it would be different hours. And then a respected career and then caring for patients. So you're pretty much respected because you're specialized in knowing everything about the lungs. You specialized in treating the lungs. So if people need more information about it, they're going to come to you because they trust the knowledge that you have. And then you're also taking care of patients who are not feeling their best. Cons, you do need to take a board exam. So once you get your degree, that does not mean that you can work in a hospital. You have to pass a board exam to prove that you learned something from school and that you can take care of people. And then it's also long hours. Like I said, 12 hours is a long time. And then you're on your feet all day, but you're also exposed to a lot of pathogens and diseases. So with COVID, when COVID first happened, some patients were not tested at first, and that's like the very start of COVID. And that's when they discovered some of the cases in the hospital. And it's, if you were taking care of that patient, you would have been exposed to COVID. So now they're very good in the hospital about testing the patient once they come through the emergency department. However, here and there, sometimes you'll just come back to work and then the patient you took care of last night ended up being COVID positive. So it's a hit or miss. However, you do have to protect yourself. So what you would study in a major. So you would, like in respiratory therapy, you would have to go through math, English, science. That's the basic stuff that you have to go through. So with respiratory therapy, we did a lot of science. So physics, chemistry, and then biology and anatomy. Anatomy is when we studied like the whole body. And I would say it's one of the toughest classes because it's pretty much going to go deep into like everything that has to deal with the body. So it's different than the other science classes. And then chemistry is also important because as you can see, we're dealing with gases and we have to understand like everything behind that. And then the first year would be pretty much all the general classes. The second 2 years, that's when you go into the respiratory classes. And with the respiratory classes, you would go as simple as like learning terms all the way into like using a mechanical ventilator or going to clinicals and practicing in a hospital. And then lastly, the fourth year, that's when you take your electives. So that's how it was with most universities. However, one thing to know is that you do not need a bachelor's degree to be a respiratory therapist. You can take an associate degree. However, if someone has a bachelor's and you have an associate and you apply to a job, they're going to take whoever has the bachelor's degree, and whoever has a bachelor's degree will get paid more as well. And then, oh, I think someone is trying to enter. And then what do you need to work? So like I said, you need to pass through school. You need to pass through school. So once you get your bachelor's degree, your associate degree, you have the degree already. You can use that to go take your board exam. Taking the board exam is going to be like 2 different 3-hour long exams. First one is going to be multiple choice. Second one is going to be more case studies. So it would be like, this patient came to the hospital short of breath and their oxygen level is dropping. What do you think we should do first? So it's kind of questions like that. And then lastly, earning your license. So once you pass your boards, you can apply to the state. You have your board exam certificate, your degree, and that's when you are able to get your license. So during COVID, because they needed a lot of respiratory therapists, they allowed some of the states, like if I have a license from DC, I can work in Virginia or Maryland because the hospitals needed more respiratory therapists. Now it's going back to like how it originally was. If I want to work in DC, I have to have a DC license. So yeah, that's how it is now. So respiratory therapy is a high demand field, and mainly because of COVID and even before COVID. However, COVID definitely had a lot of effects on it. A lot of the patients that came to the hospital ended up getting like breathing tubes and breathing machines, couldn't get off the breathing machine. They pretty much stayed on the breathing machine so long that the muscles of their lungs stopped working as good as how it was before. So they would end up with a tube that needs to be taken care of by a respiratory therapist. So a lot of the hospitals need more of us to be able to take care of these patients. And that's pretty much it about respiratory. Do you guys have any questions? Okay. So it depends. For example, I once had a patient that was 22 weeks old. There's a baby that was this small. So this baby was hard to treat because their lungs are not fully developed. Their lungs were like this small. It's still not big enough to like work. And then there are also patients who are like very old or like elderly, I should say, who pretty much whatever you try to help them with, like things would just like not work as best as they are. So it depends on each patient. But wherever you go, you're always gonna find like a patient that is very hard to treat. So it's common to see. I was half of the time I was a student, so I was doing practicing in school and in a hospital. And then once I graduated, it was still COVID. So yeah, so I got to see both as a student and as a therapist. Yes, yes. So when I was a student, whenever I went to clinicals, I get to leave, even if there is a code or anything. That was the time, like I go there from 7 a.m. till 3 p.m. and then I leave. But now that I'm working, if like they bring a patient that is very sick or a code happens at the end of the shift, obviously I'm not gonna walk away and say my hour is finished. So I would be there. So the hours are different because once you're not a student anymore, you have a license and you have patients to take care of. But it's different because as a student, they told us COVID is out there. Do you want to continue clinics? We said yes, and we went to the hospital. But we also were thinking like, what if we get COVID? And that was the very start of like the pandemic. But yeah. Yes. So not only CPR certified, there is also something called ACLS, and that's more advanced. So CPR is just when you're doing compressions and basic stuff. ACLS is when the patient, like you're doing CPR and it didn't work and it like progresses more into like medications and then heart issues and then putting a breathing tube and all the other stuff. So we have to have both. The shield? Yeah. Which one are you talking about? Which glass? Is it just like a shield cover or is it like a whole hood? Okay, so this is a very good question because for respiratory, we go in and we see patients who get like this kind of breathing treatment. So this is very small. So if you don't have an N95, it's gonna pass through your mask and it's gonna go all the way. Even having the shield can help a little bit, but it can still pass through your mask. Yeah, right there. Yep. So if it's a patient that's not COVID positive, a regular patient, I can actually go like this, or I can wear a face shield in case something spit or mucus like flies out. because we, just so you know, we deal with mucus a lot. It grosses a lot of people out, but we have to see the color. We have to see if it's thick, if it's thin. I'm sorry. So it's our profession. So we deal a lot with stuff like that. What was I going to say? So with patients who have like a tracheostomy tube, if they cough, stuff like that, you need the shield. You need the shield and you need to be on the side of the bed. You can't just be in their face. But if it's a COVID positive patient, you would have to have an N95. And the N95 have to be fit tested, which means they have to test you with a nebulizer that kind of tastes like sugar. So they would put you in a hood, put that nebulizer in, and while you're wearing your N95, if you feel it, that means still stuff is escaping through the mask. So you would have to get a different size. And then there's a PAPR, which is what I wear. It's pretty much like a spaceman hood that goes all the way over. It looks funny, but you don't have to deal with the size of the N95 because the N95, it's not, you put it on and that's it. You have to make sure it's tight seal around. So yeah. And with the PAPR, you would have a machine strapped up around and you have the big hood that scares the patient away. So yeah. Yeah, so the shield doesn't really do anything if you're in a hospital and you're given treatments that will escape through your mask. The shield doesn't really do much. I would say the most difficult part was having a patient that you know for a long time pass away. So this actually happened to me this Saturday. There was a patient that stayed in the hospital for like 2 years. Everyone knew that patient. And on my shift, they ended up passing. So it's hard. But sometimes you have to, keep your head straight. Like if a patient passes away in the same shift and you still have to take care of other patients, you have to make sure that, you pay respect to that patient, but at the same time, you have to make sure you're taking good care of the other patients and you're not making things like interfere with one another. But it's a good question. Oh yeah. Yeah, so I work night shift, so I have to wake patients up. They're not happy all the time whenever I go there. So, but you'll find patients who have very good sense of humor. Like wearing the PAPR, there was a patient that started singing a spaceman song when I came in. So there's always like funny patients that you see, and it's it's fun. Any more questions? The patient or the therapist? So the patient, it depends where you want to work. So for me, when I did clinicals, that's when I first got to give medications to patients. That's when I first got to practice. So I started practicing as a student, but I would have a respiratory therapist with me at all times. So they would be like, put this medication here, give it to the patient. So that's when you get to learn. So by the time you take your boards and you start working, it's stuff you have seen, but now you have your own license and you're doing it by yourself. But I would say it's different than when you're a student. Because when you're a student, you can always ask questions. But when you're alone, you would have to search. You would have to ask people before you do it because no one else is going to be watching you and stopping you before making a mistake. So it's people's lives and you'll always have to be careful. So, so I mean, a lot of people, not a lot of people, but there are people who say like they're in it for the money, but to go through school and study for so many hours and go through 4 years of school, you have to be interested in it. Otherwise, like there's no way you're gonna go through all of that. But I mean, you never know. So even if someone graduated and went to work just for the money, they're not gonna be happy because they're gonna be doing something that they're not interested in. You'll still see some of these people, but who's gonna be more happier? Yeah. The pay is good, and especially during COVID now, they started, or something that have already existed is travel respiratory therapists. So you travel. So you would do like 1 month in Washington, D.C., and then the company would be like, they need someone off, like respiratory therapist in Los Angeles. And then you would just go over there and become a therapist. That takes a lot of experience. So you definitely have to learn how to do everything, get experience, and then be able to travel to different hospitals. But yeah. Any more questions? Yeah. So I think the first thing you should prepare yourself for is probably getting to know the profession more. So know like how they work, what do they do? I mean, it's kind of like what I explained, but kind of you searching on your own and seeing if that's something you really want to do. The main reason why I say that, for example, for me, I have asthma. So I wanted to be in the healthcare field. I didn't know what I wanted to do. But someone one day came up to me and said, hey, you should do respiratory therapy. I searched about it. I was like, okay, I can learn about asthma, but then I can learn how to treat patients who suffer with lung diseases like me. So that's when I became more passionate. And then school became actually fun. While it's still like hard, it became more fun. So I would just try to see if it's something that sparks interest in. If it's something that you feel like you can actually go to school for, learn more about, and go to work every day doing that. So yeah. No problem. Any more questions? I'm glad. That's good. Um, okay. I do have an activity. We can do it later or now. It's up to you guys. Right now? Okay. So we talked so much about the breathing tube. So I'm gonna actually use a straw. And you can see the mannequin behind me. So to where? The lab? Okay. So we're gonna come back to this activity later. Okay.